Jump into our conversation here this morning, talking about the state of Alaska healthcare, and specifically Providence Health and Services in Alaska, with the CEO of Providence Medical Center, Regional Medical Center, Ella Goss, who runs Alaska's most important healthcare institution in good times, but certainly in bad times. A critical piece of Alaska's healthcare infrastructure and society in the state. So without further ado, Ella, thanks for making time to be with us. I appreciate it.
Thank you, DJ. You can go ahead and advance the next slide. So good morning, friends and colleagues. I'm Ella Goss, and I serve as the Chief Executive Officer for Providence Alaska Medical Center. I know we had hoped to meet in person this year, but here we are in the virtual world, making it happen, remaining separated while this pandemic moves through our communities. Before we jump into the rich, forward-thinking conversation we often have together here at the State of Reform, I'd like to invite you to take a moment to reflect. Do you remember the last time we were all together in person at the 2019 State of Reform meeting? Do you recall what we talked about? What were you thinking? I remember exactly where I was sitting in the audience, who was at my table, and the speakers. Like Providence's Regional Chief Executive, Preston Simmons, who talked about Health 2.0, population health, and the quadruple aim. I do not recall any sense of fear or uncertainty about the future. Certainly not in the same sense that I felt in the past 18 to 20 months. The speakers in 2019 also talked about the future, affordability, and what we needed to do to create a health system that's appropriate for all Alaskans, and how we keep care in Alaska. That was reasonable. And is it any different than what we need to think about and talk about 2 years later? So how have the last 2 years changed us, influenced our thinking? Alaska's healthcare needs are the same: access, affordability, preventative rather than reactive care. And at Providence, we believe health is a basic human right. Next slide, please. So here we are in 2021, and like so many hospitals across the state and the nation, Providence Alaska Medical Center has been stretched beyond anything we have ever experienced. The numbers of hospitalized, critically ill patients in Alaska is the highest it's ever been. The emotional and physical toll on our caregivers and providers, in some respects, has been devastating. We know that they are fatigued, burned out, and becoming more demoralized when we need them to be resilient, to keep coming to work, to provide safe, high-quality care. Our communities need them, and you need them. So how do we come together again in collaboration and partnership? How do we continue the partnerships that we've established? Can we make one more push to get through this surge? So much has happened over the past 2 years. We have come together as a community to keep our friends and neighbors safe, like we've never done before. A few of the ways that we came together included complying with masking and social distancing mandates, adjusting our business hours and services, standing up COVID testing sites, standing up alternate care sites, establishing visitor restrictions at our hospitals and businesses, reduced or stopped traveling. We've worked remotely. We've become virtual meeting gurus. And let's just admit it, we've completely changed the what to wear to work rules. Suit jackets and pajama bottoms, and yes, you know who you are. We've also given each other grace as we've made decisions in the moment. While we're all eager to go back to normal or the way things used to be, the pandemic has forced us to advance our business practices, modernize, and become more efficient. A healthy economy requires healthy community members. Healthy community members must have access to affordable care. Across the state, employers and communities are continuing to be impacted by financial and social disparities, health inequities, state fiscal challenges, and in some of our communities, even climate change. This pandemic has allowed us to build a framework to modernize healthcare in Alaska. We know what works to reduce the cost of care. I'll give you an example. Pre-authorizations are burdensome and time-consuming for care navigators. The inability to get a pre-authorization can delay treatment. That in turn may lead to an increased acuity for that patient, a need for more treatment. Or it may cause a delay in transferring a patient from an acute care environment to a long-term care setting, which leads then to an increased length of stay, which increases costs and takes up beds that acutely ill patients may need. Thanks to our partners at Premier and Aetna, waivers have been provided to move patients who are deemed appropriate by transferring and accepting facility, appropriate by the transferring and accepting facilities more efficiently. Going forward, is there a way to keep those efficiencies in the work stream when we're not in crisis? We need to bridge the future and what we were imagining and working towards. I am a hospital CEO, and I spend my time walking the halls and leading teams in the hospital. But hospital operations are not all that I think about. I think about the health and future of our community. So today you will hear about value-driven systems of care, clinically integrated networks, health policy, workforce, and social determinants. As we look at our partnerships and collaborations, what could the future look like? Over the last 2 years, we've enhanced our efforts to address affordability, social determinants of health, and the changing demands on healthcare workforce development. In the next few minutes, I'd like to chat a little bit about the things that Providence is doing in partnership with others in our community. So social determinants. We know that access to safe, affordable housing, food security, and transportation provides stability and security so that people can think about and attend to their health needs. In 2020, Providence, Alaska invested $70 million into our communities, including $8 million in community health investment to address access to housing, food insecurity, and other critical needs in our state. We've also been very fortunate to partner with entities like Rasmussen and Widener to address housing. Consumerism. Patients have become very sophisticated consumers. They have come to desire a level of ease and access with expectations of consumer-centric experiences with retail, digital speed, combined with self-care opportunities. Patients can now schedule appointments, view lab results, and conduct a virtual visit, and so much more on the Providence mobile app. Some features include a map to nearby express care clinics, on-demand express care virtual visits, bill pay options, and access to MyChart, which connects patients with visit notes and lab results. Financially, value-driven outcomes must be modeled through physician partnerships with healthcare administrators. Value to the patient should be top of mind when engaging with when engaging in and experimenting with alternative payment models, bundled care initiatives, and non-traditional partnerships. Providence launched an Alaska clinically integrated network. We've created physician-led steering committee to establish a CIN in Anchorage. We are currently recruiting physicians and other providers to join the CIN and establish clinical initiatives and metrics to enhance the quality, service, and cost effectiveness of patient care. The CIN will create a vehicle for providers to negotiate costs and achieve superior reimbursement rates. It also improves patients' access to quality care and provides physicians with actionable data to better manage patients across the continuum of care. You'll hear so much more about CINs in the panel immediately following. Culture change. In my opinion, this is the most important and will be the most difficult to achieve. We've all heard that healthcare in Alaska is 20 years behind the rest of the United States. Disruption and innovation. We all have a love-hate relationship with these concepts, don't we? All of us at the conference want to be innovators, but this leads to disruption in how we all do things and a reluctance to adopt to changes that may impact our bottom lines. We're currently working with our partners toward a clinically integrated network to achieve affordability and accessibility to keep care in Alaska. This includes looking at fee-for-service versus employed practices. When we work with payers, we're talking about bundles of care. We're also increasing accessibility with express care and digital technology. Technology. Just as patients are looking to digital apps and artificial intelligence to enhance their healthcare experiences, hospitals and other healthcare businesses are looking to technology to provide a better experience for clinicians and patients. We need to embrace that medical technologies that we've been slow to adopt or even resisted will help us move forward. In 2020, PAMC launched its Service Operations Center. This center utilizes technology to identify trends, opportunities, and bottlenecks and reduce patients' length of stay in the hospital. We're using predictive analytics. PAMC also formalized our Patient Transfer Center as a single point of contact for all transfer requests. It provides potential accepting MDs with hospital capacity information to assist with decisions for acceptance versus medical management at an outlying facility. Transfer center nurses have aided in reducing unnecessary transfers. And since the center launched in January of 2021, it has received 2,800 transfer requests, accepted 2,100 transfers, and declined only 275 transfers. In the digital space, Providence offers telehealth programs throughout the state that increase access to quality care and reduces pressure on brick and mortar facilities. From March of 2020 to August of 2021, Providence, Alaska has facilitated nearly 23,000 counselor visits and nearly 19,000 physician visits via telehealth. We've also had 662 tele-ICU patients in the second quarter of 2021 alone. Additionally, our COVID-19 home monitoring program has allowed us to safely monitor COVID-positive patients at home and preserve hospital beds for acutely ill patients. Our team of 30 tele-ICU and phone triage nurses has monitored 840 homebound COVID patients since March of 2020. Patients are sent home with a pulse oximeter and thermometer to self-report their conditions 3 times a day. Nurses monitor the data and seek further support from telehospitalists or send patients to the emergency department when needed. So, my friends, COVID has been our disruptor, but it has also accelerated our journey to Health 2.0. We've been forced to embrace technology, forge partnerships, and build alliances to make the best decisions for our patients and communities, sometimes with little information, but we have done it well. And even though things feel really hard, and we are having trouble seeing the end of this, we have served our community and state very well. Now the question is, do we have the fortitude to continue to make the changes and move towards accessible, affordable healthcare for the future? Are we the leaders we claim to be? I believe we are. And I believe that this pandemic has provided us with a roadmap, so let's follow it. No matter what track you participate in today, you will hear from many in our community who are working towards creating a better future for the state of Alaska. So as I close out here, I would really like to give a shout out and a very sincere thank you to my fellow healthcare leaders, our physician and industry partners, and most especially, our frontline caregivers. I would like to leave you with this last thought. This past weekend, we honored and recognized the incredible, heroic efforts of so many first responders during a very intense but comparatively short event. This pandemic has been a constant and protracted, intense event, and I am equally as proud of our frontline caregivers and our first responders for their heroic and persistent efforts. I hope that in 20 years, we are honoring them in the same way. And I also hope that in 20 years, history is as kind to us as it has been to everyone who went through that terrible event 20 years ago. Thank you so much for having me. Back to you, DJ.
Well, thank you, Ella. I appreciate that perspective, particularly at the end. Let me just first remind everyone in our metaphorical room that, of course, you can pose your questions in the chat box on the right and upvote those with a little thumb up icon, and we'll make sure that we get those integrated into the conversation here. Ella, as you talked about, you're a nurse. You've been at Providence for a few years now, since 1997. And I know you have, I think it says 3,700 caregivers. Tell us just a little more about how many of those folks are doing. I think we know they're having a real challenge. Just give us more insight. So we hear stories about trauma that folks are going through as providers and high burnout rates, and just can you bring that home and make it a little more real for us?
Absolutely, DJ. And thank you so much for asking about our caregivers and our providers, because it is imperative that we take into consideration what they've been going through. So I'd just like to walk you through, just imagine that every day you come to work, you're not really sure if you're going to have enough people to care for the patients who are coming through the door. You're not sure if your caregivers, your other caregivers, are going to be seated next to you because maybe they have, or someone in their family have been exposed to COVID and now they have to be in quarantine. Imagine having to put on so many pieces of equipment to keep themselves and the patients safe, breathing behind you. We've all had to breathe behind these masks, and many of us don't put our masks on because they're very uncomfortable. So imagine putting on a mask, some eye goggles, a shield over the top of that. And in some areas, what we call PAPRs. So a whole device that goes over your head with a battery-operated breathing apparatus. And then putting on gowns and gloves. And that's just to go into the room to see one patient. And in the emergency department of Providence, we are a 55-bed emergency department. We have sometimes up to 30 patients held in the emergency department. So not only are those emergency room nurses and physicians caring for the people who are coming in and out, because we don't shut the doors when we have a lot of patients held, those patients are still coming. And our caregivers and providers are donning and doffing for every patient. That in itself is very, very, very difficult to be doing on a daily basis. It's time consuming and it's very disruptive to being able to have that thought process around how you're providing care. I'd also like to bring attention to there's so many healthcare needs and behavioral health as well as mental health care needs that our providers need to have that need to be offered to them. They need a place where they can talk about what's going on in the community. Many people who come to work every day are sometimes very angry that the community members are not always protecting themselves and protecting others around them. So having to be able to care for someone without having any kind of background into what that person may or may not be doing, but maybe feeling some anger towards someone because here they are bringing COVID into the hospital or exposed to COVID because maybe they're not following some of the safety guidelines that are out there. So it's imperative for us to be thinking about how constant that pressure is, how much they come to work every day and give 110%. And we ask them to do it over and over again. When we have staffing, we're in a staffing crisis. We are in overloading of the hospital crisis, and people are burned out. I don't know if that helps paint the picture, DJ.
Yeah. Yeah, no, that's great. I appreciate it. Thank you. Let me ask about vaccinations of hospital employees. Some states, some hospital systems are advocating and are requiring that in other states. You mentioned culture change. There's a decidedly mixed culture around vaccinations in Alaska for a lot of longstanding reasons. What are your thoughts on, I'm not aware that Providence has required its staff to be vaccinated, but how do you manage that sort of tension if you are having people show up as patients who are sick, but you also have people show up as employees who may not be fully protected from vaccinations as well? Do you have any thoughts on how to navigate that kind of fine balance?
This is a really difficult question for all of us who have frontline caregivers and who are serving the community. Vaccinations are important. We have vaccinations for many, many different things. We have MMRs, we have chickenpox vaccinations, we have shingles vaccinations, flu vaccinations, pneumonia vaccinations, and now we have a COVID vaccination. I think the most unfortunate event around the COVID vaccination is how it's become so politicized and so divisive in our communities. At Providence, what we are doing is following CDC guidelines. We are also following previous policies that we've had in the past around our flu vaccinations. We hope that people are doing the right thing and getting vaccinated, and if not getting vaccinated, doing the right thing to keep themselves and their families safe. We'll continue to monitor what the CDC as well as some of the federal guidelines are around vaccinations, and we'll incorporate all of those into our policies and procedures as we move forward. Right now, we're following our previous flu vaccination policies.
Senator Heffern has been at work on health reform in various capacities for a long time in Alaska. She asked this question that you referenced about the value-based initiatives in place at Providence. She asked if you could speak to how the value-based initiatives and operational efficiencies have resulted in cost savings at the individual patient level. I know there are a lot of sometimes savings accrue at the system level or at a community level in different ways. She's asking about how individuals might experience the benefits and results of some of that work. Can you hear me there, Ella?
So you were a little bit broken up, but I think the gist of the question is how, with value-based care, how is it reaching the patient?
Yeah, how are costs getting, how do the benefits of value-based care get experienced at the individual level rather than at the system level?
So that's a great question, and we're still working through that. As we work with our partners to create a value-based care system. So let's look at bundles. If we're able to create a bundle of care, so looking at, instead of every single entity that is part of the patient's care is a separate charge or a separate billing action with different providers, we're hoping that the bundle of care can bring providers, hospital charges, as well as the payer charges together to create one cost center for one instance of care. You'll hear a lot more about what those bundles of care might look like throughout other presentations today. But the hope is that if we can put those bundles of care together, we're not providing patients with many repetitive billing from the different providers as well as from the hospital, and just giving them one bill with one level of care and then reducing the cost through that bundle. And there are much more smarter people out there who can really speak to that on a much more defined level.
The good news, for me at least, is that working in healthcare, there will always be someone smarter than me out there. John Son of Phillips asks, he says, regarding your comments about disruption and innovation, he says that he agrees that acceptance is a key piece, that it must come before some of those other actions and disruptions come into place. So he asks about your experience and your sort of cultural awareness, thoughts about cultural change, and how do we get to acceptance just on the, how do we disrupt sort of people's slow to accept. I'm trying to modify his question here. He says, how do we disrupt just the acceptance piece? How do we get people, in other words, to move towards acceptance so that we are less likely to be closed off to all disruption and innovation as a general rule?
Wow, that is a great question, and it's actually a very, I think, complex and comprehensive answer. But I think the most succinct answer that I can give today is, let's think back to 2019, as I asked us to reflect on. Think back to 2019. We would never have believed that we would be doing state of reform in this format. And so I think sometimes what happens is the disruption comes to us that we're not expecting, and we end up having to very quickly change and modify our behaviors as well as how we are presenting ourselves in the community, how we are accepting some of those digital technologies, and then really move towards implementing them and putting them into practice. I think if this hasn't been a lesson in what disruption can help drive, then I think we've missed the boat here, because Providence was trying to stand up the express cares, trying to move into the digital world. And Providence was just like everyone else. It was pushing that boulder up a hill. We were still participating in travel for one-day meetings, and we turned on a dime. We figured out how to put together digital meetings. We figured out how to become remote employees as well as remote employers. And so I think when we think about take away what our own personal needs are and think about the greater good, that disruption then becomes the catalyst for us to be able to move into the more futuristic, if you will, innovations that are out there. And I think if we want to call ourselves leaders and innovators, we have to accept the disruption for what it is and move and lean into it rather than leaning away from it. I don't know if that's the answer John was looking for, but I think if we look at the last 2 years, we just need to lean into it. Hopefully not through a pandemic perspective, but lean into disruption and change.
You spoke to a number of things. I took a lot of notes on your comments. I'd love to keep asking you questions. I know we're short on time. I want to ask just about one thing you said related to the evolving relationships between Providence and physicians. You mentioned some community physicians and some employed and contracted, and the CIN certainly is another kind of level of relationships between the hospital and physicians. How would you sort of characterize the lessons learned over the last 5-6 years about how Providence can best work with physicians in the community, whether they're independent or employed? Any sort of aha moments that you've gathered in the last 5-6 years that you can share?
DJ, if I had to tell you or run down through all of my aha moments over the last 5 or 6 years, I could spend all day with you.
Yeah.
I think there are so many lessons to be learned in the last 2 years. But what I think is most important is that Providence is just part of the healthcare system in Alaska. I know that we're a big name and we are really out there across the state in many communities. We really try to do good for the community. I think the most important part is that we are trying to connect in the best way to provide the most highly efficient, safe, high quality healthcare for Alaskans. And we need to be in partnership with our physicians. And, you know, quite frankly, like I said in some of my comments, we have all talked about Alaska being 20 years behind the rest of the lower 48 when it comes to healthcare. And we've moved very quickly in the last 2 months, 2 years. We have a long ways to go still, but we've built some relationships. And I really sincerely hope that looking at things like a clinically integrated network, where we are bringing our physicians forward and asking them to lead, to be part of steering committees, to be part of a integrated network that provides really efficient, accessible care, affordable care to Alaskans. And we can just continue to move in a direction of being in partnership and in the same mode of building a healthcare future. All I can ask or all I can say is that we just need to continue with the relationships we've been building and learn to trust each other. It's all about trust. I know that it feels like Providence is out there doing a whole lot of things, but we are trying to really build a healthcare system that the community of Alaska needs and can participate in.
Ella Goss, the CEO of Providence Medical Center, Alaska, thank you very much for making time and taking these questions and offering some insights. I appreciate it.
Absolutely. Thank you so much, DJ. I really appreciated being here.